And welcome back to Houston Newsmakers. I'm joined by Dr. Bob Sanborn, President and CEO of Children at Risk, and by Amy Smith, the Senior Director of Operations and Communications for the Harris County Domestic Violence Coordinating Council. You know, our children are being injured in ways that we just, by adults, and sometimes just by the negligence of adults.
Yeah.
What are you seeing, Amy, in your capacity, where changes can be made? I know you're on the front lines of trying to advocate for making changes. What do you see that's going to be most helpful and you think impactful to try to help parents become more aware of what their responsibilities are? We talked just before we went to break about the hospitals who give out a sheet of paper. There needs to be more.
There does need to be more, and you can start at an early age with educating children about a healthy relationship. I mean, I had a conversation with my 4-year-old nephew about consent, because it needs to start early and it needs to start young. He's 9 now, and we still continue to have conversations. And it could be just as easy, you know, when a parent tells a child, "Oh, go hug that person." You know, they don't have to hug that person if they don't know them or they don't want them. I mean, you are already telling a child, okay, here's an adult, you have to do what that adult says. Not necessarily. And so you need to do more prevention. We need to get into schools to talk about it. We have a Title IX committee that works with schools trying to learn about, you know, healthy relationships, about domestic violence, about teen dating violence. You know, and our committee's doing a great job, but it's not everywhere.
Bob, your program, you have so much to offer with education, advocacy, all those things, and your website is a real treasure trove of information about what we need to know about making sure that our kids are safe.
Yeah, and I think it all comes down to we can do a lot of these programs, and there's so many great nonprofits and government agencies that are doing really nice things, but it has to come down to systems change. We have a system right now in Texas that is not working for our kids. It's not working for our families. And when we think about all of these families and all of these kids that are that are falling through the cracks, right? The safety net is just not rich enough to really do everything that we need in our state, and we're going to have to make some wholesale change.
Is that kind of having to overcome the political environment right now, which can be really dicey and so divisive right now that everything comes down to some level of politics?
I think politics is always a big part of it. But here's the thing, Republicans and Democrats alike love kids. They care about families. They may frame it in different ways, but they care about kids. And so when we go to Austin, we can lead with children and people are all on board. I think, though, it's when you put your money where your mouth is, you know, that it becomes sort of a deal. Like, are we able to fund some of these things? And when we look across the country, right, blue and red states alike have trouble funding a lot of children's programs, but some have gotten there. And I think Texas, because we have so many kids, because we represent the future of our nation in many ways, we're going to need to figure out how do we do more of this. And it comes down to educating parents, doing the right things in schools, and mental health. We've done a lot more in mental health, and we went from 49th in funding in America to 49th in funding. We need to do a lot more in mental health. And even if you just look at statistics like the number of counselors per kids in our schools, we're far below the national average on that. And everything, we're far below the national average.
Amy, you taught a class recently at Rice, which I thought was interesting, a mandatory class, and it was about sexuality. And it was interesting because it was on the college level, but it was a required subject for them.
Yes, it was a 6 weeks class at Rice that was that the SAFE office created and put on, and they've been doing it for several years. This is one of the first years they had off-campus people come and help because they have a huge freshman class, and it talked about consent, it talked about sexuality, it talked about healthy relationships, it talked about domestic violence, and it also talked about bystanders, what to do if you see something that's going on. And I think that's what we need to do, is we need our community involved. Domestic violence is not, it doesn't care what political party you're in. It affects everybody. It affects people from the 3rd Ward to River Oaks. It affects people from the 5th Ward to Memorial. It affects everybody.
Bob, you've got some, your report card's coming out pretty quickly. Yeah. What's coming up next for you?
Yeah, so our school rankings, as always, you know, we're back after the pandemic to really allow parents to understand how our schools need to be better. And parents really love this idea because they want to be engaged. We all want our schools to be better. Our Growing Up in Houston report, a lot of stuff coming out.
Good. We'll put that on my website so people can go to that. Dr. Bob, thank you so much. Amy, good to see you as always. Thanks for the work you do on behalf of our children.
Absolutely.
Appreciate it very much.